is up, everybody? Dr. Ryan here. I'm a board-certified specialist internist. Thank you so much for joining me in our 9th installment in the series. We are addressing the infamous Herpes Labialis. If you haven't yet subscribed to my channel, I strongly encourage you to smash that subscribe button. This is the OSCE question we are confronted with today. You've got a 26-year-old male presents with an acute onset, painful blister on the lower lip as depicted. The questions are as follows. Number 1, what's the diagnosis for 1 mark? Secondly, name the causative organism for 1 mark. Thirdly, name 4 other clinical manifestations you would expect for 4 marks. And then how would you treat it for 3 marks, right? So you've described this is a vesicle, right? It's a painful vesicle on the lower lip. So the diagnosis is herpes labialis. Now what causes this is the infamous herpes simplex virus type 1. Type 2 will cause genital herpes, okay? What are the clinical manifestations one might expect? So if it becomes disseminated, especially in a patient who is immunocompromised from whatever reason, the central nervous system can be affected in the way of encephalitis. So these patients just have generalized confusion, altered mentation, transverse myelitis in the way of an acute onset, flaccid lower limb paralysis. Well, not really flaccid, but it's paraparesis, right? Bell's palsy, which is a low motor neuron 7th. Right, ocular involvement in the way of keratitis, conjunctivitis, blepharitis, and acute retinal necrosis. GIT is one of the causes of fulminant hepatitis. So a patient who presents with fulminating hepatitis, often in the context of liver failure, you probably want to screen for serology for HSV, especially if they're immunocompromised, like we said. Genital infection, usually HSV2, but HSV1 through oral genital contact. Respiratory, HSV can cause pneumonitis, right? How would you treat herpes labialis? So initiate antivirals within 72 hours of symptom onset. Usually we go with the big brother acyclovir, 400 milligrams 5 times daily per hour for 7 to 10 days. Topical analgesia and anesthetic agents as well can be helpful. Okay, my friends, in Matthew chapter 22, verses 37 to 40, Jesus replied, love the Lord your God with all your heart, all your soul, all your mind. This is the first and greatest commandment, and the second is like it. Love your neighbor as yourself. All the law and prophets hang on these 2 commandments. So when the Pharisees asked Jesus, which is the greatest commandment, because they were trying to trap Jesus, right? To use their guile to trap him. And essentially, what Jesus is saying is that the greatest commandment is like 2 sides of a coin, right? One side is not necessarily more important or significant than the other. And the 2 sides are, number 1, love the Lord your God with all your heart, all your soul, all your might. And the other side of the coin is love your neighbor as yourself. And I pray that this is what we will do as born-again, earnest disciples of the Lord Jesus Christ. Have a lovely day. I'll see you soon with another video in this series. God bless.